Yo, it's Dr. Jason. I had some time away from patients, and I wanted to create a real quick PowerPoint presentation about how we've been really successful dealing with dental pain and dental anxiety. And I'm not a super tech savvy dude, so I tried my best to put together a presentation and share it on Facebook Live, and I screwed it up royally. So I'm going old school. What I'll basically do is introduce the video to you, and then I'm going to basically take a video of my computer and just show it to you. So here we go. All right. How we manage pain and anxiety. Again, this is my super high-tech way of doing it. So there's a difference between dental pain and dental anxiety. And for the purposes of this really quick video, dental pain is how we control tooth pain, gum pain, how we control the nerves of the teeth. And dental anxiety is how we control your fear or your history of previous really bad encounters or stuff like that. So I want to talk real briefly about both of them. So in terms of controlling the dental pain, in terms of giving the injection, first thing we need to do is get some numbing gel on the teeth. We use a really special numbing gel that is made by a pharmacy. It's not something you just buy over the counter. It's not like that Oragel stuff. This stuff is super potent. So I got to dry the tissue, and you put this material on the gums. You leave it on there for about a minute or so, and it does a really, really good job of numbing the gums. Hopefully patients of ours can attest to that. The other thing that we use is a freeze spray on the roof of the mouth. Those of you that have had injections on the roof of your mouth, you know how uncomfortable it is. And we can never make the discomfort go away completely, but there's a special freeze spray that we use that really takes the edge off well. And we hear a lot about how, that wasn't as bad as it typically is. So that's a very quick, abbreviated version of how we can get the gums numb. All right, so this right here, right? So nobody likes this. I don't even like this. And I've had some dental work done recently, and it sucks, right? There's no doubt. But using those numbing gels and the freeze sprays ahead of time really works. The other thing that we do, not to get into the weeds on this, is use a pH neutral. That means not acidic, not basic, Novocaine type solution first, so it doesn't sting. So once you give that first, and then you give the real potent stuff, it tends to lead to a much more comfortable injection. Now, is every injection going to be super comfortable? Absolutely not, because if we have to give an injection in an area where there's some infection, or in an area where the tissue is really tight, it's going to be a little tender. But we have some really cool techniques that do everything possible to make the injection as comfortable as possible. So this is the most important slide here, right? So how do we deal with dental anxiety? So it's pretty predictable to deal with dental pain, and we're very, very good at getting teeth numb. Now, we do have patients that simply don't respond well to just Novocaine. So for those patients, we have to also deal with the anxiety component. So, the most mild thing we can do, I put listed here, is distractions, right? So what do I mean by distractions? I mean, the television that we have on the ceiling, and music that you can pop in your ears and stuff like that. So sometimes patients just need that to deal with their anxiety. The next level of dealing with dental anxiety would be nitrous oxide, or laughing gas. And all the offices and all the treatment rooms have access to nitrous oxide. And what's nice about that is it takes the edge off. It's not going to put you to sleep or anything like that, but it certainly takes the edge off, so you're feeling a little loopy. And a huge benefit of nitrous oxide is once we turn the nitrous oxide off and you're just on regular oxygen for a few minutes, you can get out of the chair and you can drive home. So you don't need a driver to bring you home from the appointment. The next, I spelled that wrong. The next item is oral sedation. We do a lot of oral sedation, usually 3 or 4 cases every day. It's something that has been a game changer for us in terms of getting through dental appointments. So oral sedation is a series of medications that we give the patient by mouth, under the tongue. There's a whole protocol that we have in place where we make the patient take some medications the day before and then the day of. We have a whole protocol where we cover the sedation process with the patient and with the patient's advocate. It's a super safe way to go through a dental appointment, and we do a lot of oral sedation at the office to get patients through the appointment. They're basically in a light sleep where I can just tap them on the shoulder, and they're like aware of what's going on, but they're super relaxed, super comfortable, and it's how we do a majority of our sedation appointments in the office. And then finally, I have here IV sedation. IV sedation is a sedation that we use for shorter, more involved situations. Our oral surgeon does a lot of IV sedation with difficult wisdom tooth cases. It's not the primary form of sedation that we have in the office, but we do quite a bit of IV sedation. So those are the main ways that we get through dental anxiety: distractions of the TV, nitrous oxide, oral conscious sedation, or IV sedation. And then I put here the secret, right? So what do I mean by the secret? I mean trust. It's amazing to me how many patients literally need to be sedated to have their exam done, to have their x-rays done. And, once we get to know them, and once they realize that like we're not out to get them, we're not going to hurt them. It just blows my mind how many patients over time, and I'm not talking about a couple days, but I'm talking like over 3-4 years or so, when they need dental work, they don't need to be sedated anymore. They know that we're going to get them comfortable via Novocaine. They know that that we're not going to hurt them. They know that we're truly empathetic and care about their well-being. And it just blows my mind that once we can develop a level of trust with the patient, the need for sedation goes way down. So I just wanted to shoot this quick video just to kind of talk about how we manage pain, how we manage anxiety. I apologize that I'm not nearly as technological as I could or should be. I'm a little bit better at dental work than I am at putting Facebook Live PowerPoint presentations together, but I will get it, I promise you. It's one of my 2021 goals to be more communicative with our patient base and educate them to make sure they understand everything that they could and should. All right, so I appreciate you watching this video. If you have any questions or concerns about anything pain or anxiety management related, please don't hesitate to reach out, or anything in general. Just send us a private message or comment on the video, and I'd be more than happy to respond to your question or concern. Thanks. Have a great day.